Here's an intro to general phobias. General phobias, also called specific phobias, are persistent irrational fear of a situation or an object. And the fear must persist for at least 6 months for it to be considered by the DSM to be a phobia, or a more broad term, an anxiety disorder. Another way to put specific phobias is general phobias trigger immediate panic to attach to an otherwise non-threatening stimulus. Some of these phobias or fears can be severely detrimental to regular life. For example, you have a weird thing with the number 13 and you think it's very unlucky, and that is your phobia. So you have to do actions 13 times, or you can't turn down the 13th street that you've passed, or you can't go down a street with the street number being 13. Even if the specific phobia is silly or irrational and the person knows that, they won't get over it just because of that. It's a fear that stays with them unless sought help. So for the epidemiology of specific phobias, we found that it is more prevalent in young, low-income females developing around the age of 10. Specific phobias, if it stayed with the person, it usually stayed on an average of 20 years. Yet only 8% of the group observed received treatment for specific phobias. So for overall prevalence of specific phobias, it's about 5% in the whole world. And specific phobias also have a higher rate to be found in females than males, and it's about a 3-to-1 ratio. And like I said before, they appear mostly in children around the ages of 10 to 13. And what's really interesting is they are more common in American minorities versus the Caucasian population. So for the etiology of specific phobias, specific causes of general phobias are still left up to interpretation, although contributing factors include inescapable heredity. So if your relative had an anxiety disorder, your likelihood to develop one of those is higher because you have a relative that had an anxiety disorder. Another one would be life experiences. So for an example, in the movie The Truman Show, Truman's aversion to water was due to believing his father drowned while both of them were out at sea. Another one would be also learned information. So developing a fear of bumblebees after a trusted friend said that a bee's stings results in instant death 87% of the time, but retaining that fear compulsively even after finding out the fact was entirely untrue. So now we have some examples of specific phobias. One example of that would be panophobia, and that is the fear of everything. So Theodore Arman in 1911 described it as a state of which a patient fears everything or nothing. Now, the DSM doesn't specifically categorize doesn't specifically mention panophobia, but it categorizes specific phobias in excessive anxiety disorders. Along with specific phobias, panophobia is very common to have with multiple illnesses to overlap with other phobias, like schizophrenia and personality disorder. And another example of a specific phobia would be dysphobia fear, and that's the fear of getting rid of stuff. That could be also more commonly known as hoarding. And people are also diagnosed with dysphobia along with OCD. And then another example of a specific phobia would be metathesiophobia, and that is the fear of change. And that usually shows up around the age of 9 after like a large trauma or a large life-changing event. An example of that would be a death of a relative, losing a limb, and a freak shark accident, stuff like that. And this locks people into a specific unalterable routine, which will mutate and worsen to avoid exposure to unpredictable stimuli. So this phobia is very detrimental to people's lives if it's very serious. Another phobia we have, or specific phobia we have, is mysophobia, and that is the fear of germs. And this is more of a common phobia that a lot of people have. It is oftenly diagnosed coupled with OCD, and since the person suffering from it is likely to wash his or her hands excessively. This disorder has a very big impact on people's lives because of the fear that they aren't willing to go places that seem unclean. And sometimes the only clean place that they see is their home, so they don't, a lot of times, it's hard for them to leave their house, especially without hand sanitizer and stuff like that. Um, Although mysophobia differs from OCD in a way that I guess the constant urge to sanitize yourself, not the disorder, but the irrationally exhibited means to free oneself from an omnipresent microscopic threat. So, kind of like in the picture down below. So, another example that we have is the fear of being forgotten. And this phobia is really challenging when having relationships with others. Um, and it's kind of manifests mostly in dementia patients because, for example, uh, they know that they're losing their mind, that they're forgetting things, and this is a phobia and that they can have, and a lot of them do. Another, I guess, less severe example of this phobia would be people being fear of being ignored. So they will not go around people so they won't be ignored or forgotten. So that is their fear. So they're almost very antisocial. So treatment for specific phobias is kind of a broad thing. So what we found is the most prevalent treatment is exposure therapy. And so for exposure therapy is where a patient with a phobia is exposed to their fear uh, lots of times, like in a row. So they get used to it and they soon get that phobia out, hopefully. Another one is medication, but we also found that that is only used in extreme cases and it's not a long-term solution. So you can't give these people medication to get over their fear. I think they talked about having medication along with um, exposure coupled together. Another one would be relaxation techniques. And this one is more of like a self diagnosed treatment. And this is, you can do breathing exercises, and it can help the individual cope um, effectively with the stresses and physical reactions related to their specific phobias. Another one we had was cognitive therapy. And in this kind of treatment, people learn to identify their anxious thoughts and replace them with more realistic thoughts. And I think a lot of these treatments go hand in hand with each other to, you know, uh, treat specific phobias.